and welcome to another episode of Senior Spot. My name is Jen Quinn, your host, and I'm really delighted today to have Sherry Keating here of Diabetes Kare with a K Consulting, and her specialty is just that, diabetes. And with that being such an influential part of our healthcare world right now, it's really important that we know all the best practices, and Sherry is here to share those with us. So welcome, Sherry.
Thank you so much, Jen.
Very happy
I'm excited
to have
be
you
here.
So you're a nurse, you have your bachelor's in nursing. I mean, you have it all. You have this great background, and this is your passion is diabetes.
Mm-hmm.
So many things you could do, but this is really your area of expertise. So before we get into all of the great suggestions that you have, I would love to learn how this became your passion and what's your story? How did diabetes become your mission?
Well, let me tell you, it started way back. I graduated from nursing school in '83, so I've been a nurse for a long time. And I've actually specialized in cardiac disease and diabetes. And so working with ICU patients with diabetes, working on as a telephonic diabetic nurse, I started a diabetes education program. I've taken care of cardiac patients, and cardiac disease and diabetes, unfortunately, are like brother and sister. So I've dealt with, in my professional life, a lot of patients with diabetes. Personally, I don't have anyone in my family with diabetes, thank goodness.
Oh, maybe there's a reason why, because you're so proactive.
Well, maybe that is true. But what happened was I was laid off actually 4 times as a nurse. I know that's hard for people to understand, but it happens. Mm-hmm. So every time I was laid off, I actually tried to make myself grow professionally. And so my last time I was laid off, it was in 2015, and I took the Certified Diabetes Educator exam. And I Googled kind of like, how do you not get laid off again as a diabetes educator? And this little commercial popped up about the diabetes prevention program, and I'm like, wow, this is weird.
And this was something that you were already involved in?
I actually wasn't. I've never been involved, and I didn't even know what diabetes prevention, I didn't even know you could prevent diabetes,
okay,
to be honest with you. So I actually Googled about the diabetes prevention program, and I'm like, you know what? This is what I want to do. I want to prevent diabetes because I've seen the devastating effects. Dealing with patients, there is a lot of serious consequences of having elevated blood sugar. It's the #1 cause of adult onset blindness, lower limb amputation, kidney disease. It's connected to heart disease, 50% higher risk of dying from a heart attack or a stroke. And really every 5 minutes, 2 people die of a diabetes-related
So, I mean,
complication.
when you think about it, diabetes always comes with a partner in crime.
It
Usually
does.
it comes hand in hand with something else or causes something else that's obviously very detrimental to happen to someone.
Absolutely, and you know what? It's preventable. And that's what drove me to develop this passion for diabetes prevention. So I actually took the course, and it's through the Center for Disease Control, and I became a diabetes prevention life coach. And I said, okay, I'm going to start a diabetes prevention program. Not as easy as I thought. So, as always, nothing is. So I actually got hired back in my old hospital in Leominster, and I work per diem as a certified diabetes educator. So I see patients one-on-one. I cover their vacations, and I still do that. And then I said to my husband, you know what? I want to be kind of responsible for my own destiny.
Right.
And I've been laid off 4 times. So I said, you know what? I've always wanted to own my own company, and I want to make a difference in someone's life every day. So this is the time. If I'm going to do it, it's now.
And so, your mission is to get ahead of things. So even when you're in the hospital, you're preventing, but you were probably talking to a lot of people that had already been well on their way in developing the disease.
Absolutely.
So this way you can try to get it head on before it even starts to
That's right,
evolve.
Absolutely. So I started my company, Diabetes Kare with a K.
Yep, I love
And the K stands for Keating, which is my last name.
Very catchy,
So,
I
yes.
like that.
So I started that last September. It's been an amazing journey.
So how has it been? What have been some
Oh.
things that you've been able to do and accomplish? I mean, I know a little bit more about your story, but I'm excited for people to hear just how things have kind of rolled out and progressed for you.
Mm-hmm.
So share a little bit about what has happened since September.
Wow, I joined the chamber. That was the first thing that I did. And the first day I went to the chamber meeting, you never, you just kind of sit randomly somewhere. Well, it happened to be that I sat next to this person that really launched my career. She really loved what I was doing, and a lot of people don't understand that you can prevent diabetes. And when she heard that, she's like, oh my gosh, I need you to introduce you to this person and that person. And before I knew it, she was introducing me to all of these people through networking events and inviting people. And then I would meet more people. And I had 3 or 4 key people that really believed in my mission and my passion that really opened doors for me.
Oh, yes.
It's unbelievable, the outpouring of support that I've gotten since I've started this company.
You know, with something that isn't usually a positive part of someone's life, you're taking a positive way of trying to not have it happen. And you know, I mean, who's not a fan of somebody being proactive? And you know, and usually that's not the case. So it's nice that, you know, when people come to see you, hopefully it's because they're trying to prevent something from happening, not obviously dealing with the chaos and things that happen along when things do happen. So, you know,
that's very true. And I think more people need to become more prevention minded and proactive in their health. And I live with a chronic disease, and I'm also a cancer survivor. And so because I'm a cancer survivor, I had a very rare cancer. It was not responsive to chemo or radiation, and my outlook was very dim. And I just believe that I'm here today for this purpose right now. And I'm able to make a difference in someone's life, and that's really what my mission is, and it's through prevention. So as a new business owner, I was very narrow focused. I really haven't been a business owner. I've started programs, developed them, managed them, have been a nurse manager for 17 years, but being in your, you know, having your own company, as you know, is a different story. So I had some great people. I was mentored by the SCORE organization, where those are retired business owners, and they mentor new business owners for free through the chamber, and they really kind of directed me. And then I had all of these supportive people that I met through networking events that just really taught me, and I have a long ways to go, but I'm on the road.
But I mean, the whole idea is education, education. And I mean, that is your mission, is to get the word out there and to be able to say, you know what, there are different ways, you know, to be able to kind of to try to slow this epidemic, which I would really love for you to share a little bit about that and what the statistics look like, because, you know, people say, oh yeah, I know somebody with diabetes, but share with our audience exactly what, you know, the grim sort of overview is right now.
Grim, unfortunately. There are 29.1 million people that have diabetes in the U.S. But what's even more troubling is there's 86 million more that have prediabetes, and 90% have no idea that they even have it. And what they're estimating is that 1 in 3 will have type 2 diabetes in their lifetime. And what even scares me more than that is that over 5,000, it's like 5,034 kids under 20 now are developing type 2 diabetes. So in my career, type 2 diabetes was a disease of the older generation. But now, because of lifestyle habits, now it's affecting kids. And that's very scary to
So
me.
can you speak a little bit more about the lifestyle habits, which then inevitably leads to how you can prevent it? So what are some of the lifestyle habits that have contributed to this rise and, you know, this earlier onset?
Well, insulin resistance is what prediabetes is. And what that means is that you make insulin in your pancreas. There's cells called beta cells that you are actually making insulin. But what happens when you become insulin resistant, and the 2 key things that cause insulin resistance is excess weight around your waist and inactivity. And when
which
you
usually go hand in hand. I mean,
if
you're inactive,
and if you look
typically.
at our country today, we have an obesity problem. So that's where we're at right now, and that's why we have this trickling down into our youth. And so if we can decrease our weight, and the Diabetes Prevention Program is a proven scientific evidence-based program that says that if you can lose 7% of your body weight through healthy eating and exercising 30 minutes 5 times a week, you can decrease insulin resistance and prevent type 2 diabetes by 58 to 71%.
I want you to repeat that for us, because that's like a prescription, in my opinion.
Absolutely.
So you said you can reduce it by 50% by doing exactly what?
So what you want to do is you want to eat healthy, and you want to really watch your fat intake. Low, you know, get rid of the added sugars, eat your whole grain. So my plate is really, I talk a lot and teach classes on my plate because it's a balanced way of eating. So what my plate is, it's a 9-inch plate. You cut it in half. You have fruits and vegetables on one side. The other side, down in the quarter, you have a lean protein. So you want less of the beef and you want more chicken and turkey without the skin, fish. Then you've got a whole grain. A whole grain is all of the parts of the bran. So it has fiber, and fiber helps lower your blood sugar, and it helps with cholesterol and keeps your GI tract regulated. and then you want a low-fat dairy. If you can eat like that, balanced meals, then you can lose 7% of your body weight. You add 5 days a week of 30 minutes of exercise.
So that's the second component.
That's the second component. So healthy eating is one, and then the physical activity is one. And it's cardiovascular exercise. So it's not like you have to go run a marathon. You don't have to buy equipment. I tell my patients, God gave you 2 legs, just use them.
Right.
You know, and so you can literally just walk.
And you know, I think a lot of people will say that there's a time constraint around 30 minutes, but speak to that it can be broken up, because that's important for people to know.
The good news is the studies show that even 10 minutes, 3 times a day at a moderate pace will give you the same health benefits.
Yeah. I mean, sometimes it means taking the stairs. Sometimes it means parking a little further and not worrying about getting the closest
space.
space.
That is not going to, well.
Or is it that, or is it actually a brisk raising your heart rate?
It's not brisk, it's moderate.
Okay.
And it's raising your heart rate. So
Okay.
those would be added bonuses. Taking,
that's
taking
just
the
a good
stairs.
thing to do
That's
in general.
a good thing to do in general. And what they're now recommending is a movement break every 90 minutes.
Ah.
So if you're sitting for more than 90 minutes, you need to get up and move your body for about 5 minutes.
Sure.
And if you're already diabetic, they're actually saying 30 minutes. Every 30 minutes, you should be get up and walking.
Wow. And can you speak to why and what the benefit of that is? I mean, everybody knows that exercise is good, but why in particular related to diabetes?
So this is what it is. You eat a meal, okay? And when you eat a meal, you create sugar. And then as that process is digesting, it signals to the beta cells in the pancreas to make insulin, to increase the amount of insulin. And then the insulin and the sugar will go through the bloodstream. And the key is that insulin is the key. So pretend you're leaving here, you're going home, your house is locked. You put your key in, you turn it, the door opens, right? Well, think of the cell having a door. And the insulin is the key. So you put the insulin into the door and you turn it, but guess what? You're insulin resistant. So it's not opening the door. So the sugar is not going into the door like it's supposed to, in other words, the cell.
Okay.
So what happens is it floats around in your bloodstream, and that's why people have eye disease, kidney disease, nerve disease, heart problems, stroke. It's that not the inability of the insulin to actually get the sugar where it's supposed to go in the cell.
So it's floating around, it lands somewhere else and in your bloodstream, and that causes the
complications of diabetes. Now the excess weight around the middle causes the inflammation that causes the inflammation in the arteries, increases the risk of heart disease and stroke.
Okay.
And vascular problems.
Right.
So if we could decrease insulin resistance by even losing 7% of your body weight. So I tell my patients, if you're 200 pounds, that's 14 pounds.
Yep.
And we all should actually be eating this way.
Now, what if somebody is already eating well and somebody already is within a good, healthy weight?
Mm-hmm.
I mean, that's not somebody that you would say, you know what, go ahead and lose, 7% of your body weight.
No, if you're not
really
overweight.
speaking to people that are overweight, that have that body type, that that really needs to address it. Okay.
So let me tell you about the risk factors for diabetes. Men have a higher risk. I'm sorry, men, but you have a higher risk. And then people over 45. And then if you have a family history, your primary relatives, so that's your mother, father, sister, brother, not your Aunt Susie or your Uncle Joe. People, if you're overweight, especially if they call it central adiposity or belly fat. I don't like that term, but people understand that. So it's that excess weight around the middle. It causes your liver to become fatty. It causes the insulin resistance. It causes the inflammation in your artery.
Okay.
The other risk factors, if you had diabetes in pregnancy, the hormones at about 24 weeks can cause you to develop diabetes in pregnancy.
And how does that affect the baby?
Absolutely. They are at a higher risk when they age as well, even into the teenage years of having type 2 diabetes.
Interesting.
So yes, so if you have gestational diabetes, then you really definitely need to be screened. Certain ethnic groups are at a higher risk. If you have high blood pressure, over 140/90, or you have it under control but you're in treatment for it, you're at risk.
Okay.
If you have a good low cholesterol, the good cholesterol, that's called the HDL. And the way I explain it to my patients is the liver makes cholesterol, and we also get it from the food that we eat. So that high saturated foods that we eat, processed foods, that's going to elevate our bad cholesterol, which is called our LDL. And that goes to our arteries, narrows them and blocks them, and increases our risk of heart disease and stroke. But in our liver, we produce good cholesterol called HDL. And that will go to the arteries and remove the bad. But if you don't have good cholesterol, a high enough amount,
it's not gonna counterbalance what it needs to do.
Right, and the other thing is it's going to increase your risk of diabetes.
Interesting.
And if you have high triglycerides, it will also increase your risk of diabetes. And there's a condition called, it's a medical term, acanthosis nigricans. And what that is if it's a dark velvety rash around the neck and under the armpits, and that is a sign of insulin resistance. So a doctor you can go in the office, and if you have this like dark velvety rash, they know right away that you have insulin resistance.
Interesting.
And they're finding that untreated sleep apnea is now a risk for diabetes. So if your spouse or your loved one or someone tells you that you're snoring like you have sleep apnea or you're stopping to breathe, you really need to go and get that treated, because that does increase your risk of diabetes.
Interesting. Now, so, I mean, you are just a wealth of information and knowledge in terms of this area of your expertise. So how are you getting the word out there besides, being on the show? What are the different ways that people could benefit from, from the information and learn from you? What are some ways you're kind of, getting your passion and your word out there?
Well, I offer group classes. I offer one-on-one health coaching. So for the one-on-one health coaching, people I'm not a nurse practitioner. I'm a registered nurse, so I can't bill insurance. But people can self-pay, and then we meet, and I go to you, because I have a home office, but I don't see clients in my home office.
Well, and to be honest with you, it makes more sense to go into someone's home and maybe see the foods and see the area for meal prep and what could be an option, because like you said, most of it comes back to food.
Right, food and exercise really are the two keys. So I meet with them, they self-pay, we sit down and come up with, what do you really want to get out of this?
Yep.
And it doesn't have to be a prevention of diabetes. It could be they've been trying to lose weight and they've been struggling and they need a little extra help losing weight. They need someone to motivate them to exercise. There's a lot of different reasons why someone would come to a health coach. So, they can call me, they can go on my website, and they can contact me through my website, diabeteskare with a K consulting.com.
We'll make sure to put that up so that the people can see that.
And then, and then we decide. I don't say, okay, you need to see me for four weeks or 4 months. We decide what they feel they need, and then whatever time frame that they need, we try to meet their goals.
Well, and it's interesting because your whole take is being preventative. So I would imagine that some people that do have it in their family and they know that there's a possible risk, makes sense for them to not, I know that you also see people that already have diabetes as well.
Their diabetes,
so it's never too late to try to reach out and get the information to, you're always going to have it is my understanding.
But you can control it, and you really can live a healthy, happy life with diabetes, and people really need to understand that. But the best option is to prevent diabetes.
Right.
And you can, and this is proven, this is lifestyle, this is a proven scientific through the diabetes prevention program, and so it's simple lifestyle changes.
Well, and it doesn't seem like it's incredibly complicated or complex.
It isn't.
But it's just a matter of somebody with the right information, with the expertise, actually walking you through and telling you what the steps are. And really, it's a part of just good, healthy living.
Absolutely.
And it'll impact and it will help other potential conditions to either keep them at bay or maybe never even come about. So I mean, it just sounds like it's a smart thing to do anyways.
It really
but certainly
is.
With the benefit of being able to hopefully avoid something as serious as diabetes.
And 58 to 71%, that's a big bang for your buck when you think you only need to lose 7% of your body weight. Eat healthy like you should be doing anyways, and then do some exercise in 10-minute increments 3 times a day. I mean, it really is very achievable.
Yes.
So I really hope people really understand that message. The other thing that I do is I give group classes. I teach, as you know, and I started my company, like I said, very narrow vision, and I was just going to save the world from diabetes. But I'm doing that as well as other things. So what people started saying is, hey, can you teach healthy eating? Can you teach cardiac disease? Can you teach all of these different things? So then now I offer 10 different classes. And I'm a CPR instructor as well, so I can offer CPR classes, but I really teach about healthy eating, label reading. I actually spend an hour and I have people bring in a label and I say, let's put it through the healthy label test. And we literally dissect that label, like you're in a lab. And people
because if you can't pronounce it, you probably shouldn't be eating it.
That's right. And the first 3 ingredients is really the key. And so a lot of things that people don't understand about the serving size and the saturated fat and all that, we really dissect that. And then we also talk about my plate in detail. How many cups of fruits and vegetables are you supposed to have a day? How many ounces of whole grains are you supposed to have? Are you supposed to have fish? So we really go into that. So that's either a separate class or I do a 2-part class for that. I also teach pre-diabetes, and I actually offer the screening tool. And
what's,
you know
what's that? What's the screening tool? Is that something?
Yes, people need to take the screening test. People need to take the screening test. Do I have prediabetes.org? You can go on that website and you can take 1 minute and you can actually take the diabetes screening test.
Do I have diabetes?
Do I have pre-diabetes?
Excuse me.
Yes.
Do I have prediabetes.org? Okay.
And it's from the American Diabetes Association. It's simple. It's a questionnaire. There's 7 questions. You give yourself a number. If you add it up and you're 5 or more, there's a very high likelihood that you already have prediabetes.
So if you like a lot of things like Swedish fish and frosting and things like that,
Well,
like I do, probably not a good thing.
No, it's the fat.
Ah.
It's the saturated and the
So
trans
this is what I
fat.
wanted to bring up, because we talked about this in the past. It's not necessarily the amount of sugar.
And that's why everyone says, oh, I have diabetes because I have a sweet tooth. It's really about the way your body uses insulin. Do you know that it takes sometimes 10 to 20 years to develop diabetes?
Sure, because it's just working its way through your system and building up
Right.
over time, I would imagine.
And the body is an amazing machine. It compensates. So
it's trying to be rid of it.
it's trying to increase the amount of insulin because it's resistant to insulin. So it thinks, okay, if I produce more insulin, then that sugar is going to go where it's supposed to go. But what's happening is you're burning out those insulin-making cells. So by the time you're diagnosed with diabetes, you have complications a lot of times. And the other thing is that you've already burned out 80% of those insulin-making cells. So we want to preserve what cells you have left by controlling your blood sugar.
Right.
And I teach a class actually for CUs, for social workers and RNs. And
Yes.
and I actually taught that class for a group that you were in, and
Which was wonderful. I learned so much, and even people with diabetes in the group learned a lot.
Yeah.
I mean, that was amazing to see them participate in the discussion and say, wow, I didn't even know this. I have diabetes.
right. Nurses know diabetes, a very basic understanding of diabetes, but when you specialize, you know the ins and outs. I mean, there's so much more that I need to know myself, but I have a pretty good handle on it. But that class for CEUs, for social workers, and for RNs, it's about how the aging process actually affects blood sugar control. Because the aging population, if they have diabetes, their symptoms are very different. They may have some cognitive impairment, and
Okay.
they may not be able to manage their diabetes so that they're lowering their blood sugar effectively. So it's a very delicate balance for the older adult, because you don't want to have too low of a blood sugar. So you want to keep it
Right,
so
because
that they
can
don't.
also be an issue as
It
well.
can actually cause dementia and Alzheimer's.
Okay.
And the other issue is you don't want to have too high, because then you develop all those complications that we talked about.
Right.
So it really is a delicate balance. You really need to be educated on what to look for. So if you're a caretaker or a healthcare professional taking care of someone with diabetes and they're older, this is a great class.
Yes,
As you know,
I
and
do.
there's some
I
great
mean, I
stories
think
that come
it's-
out of that class.
Yes, I mean, I've participated in the class. One of the reasons why I wanted to have you on the show, because I know that there's so much information that can make a difference to every single person listening. Because if you have diabetes, this information is important. If you don't, then you need to do the things to make sure you're preventing the
That's right.
possibility of having it. But so, are you saying that I have the total go-ahead for the frosting and the Swedish fish? Probably not.
No, I'm not saying that, because added sugar, if you look at the MyPlate, what they want is to shift nutrient dense food, which is vitamins and the minerals that your body needs, and the fiber and all of those things.
Yep.
And added sugar or empty calories. So those are things that, like high fat, trans fat, saturated fat, sodium, and the added sugars. So
Sure.
natural sugar is like
fruits, sure.
and dairy. But the added sugar is what we really need to be careful, because it leads to chronic disease, and we're not just talking about diabetes.
So-
Cancer cells feed off of sugar. There's a lot
Sure.
of different
So
diseases.
besides, just to go back to, obviously you do presentations, you do groups, you do, many different things, still working per diem, sometimes at the hospital.
yeah.
So you're reaching people that way. I just want to circle back to the individual support that you can give to people, because certainly people can go and, take the quiz and see if they are at risk for it,
Yeah.
but then the steps in order to be able to actually have a consultation. I love the idea that it's individualized. It's something
absolutely.
where you can look at what their diet currently is, make suggestions for changes, because when people look at working with a consultant, sometimes they think their whole world has to change. But we don't all like salmon. We don't all like
It's very,
chicken.
yes.
So I mean, that's, I think, important, is that your individual diabetes care consulting addresses what an individual person needs.
And you know what? It's not a cookie cutter approach.
Right.
If you don't meet the person's needs, they're not gonna. You're setting them up to fail.
Right, and you're looking to make someone be successful at this.
Absolutely. And I always, this is the first thing when I see a new client. The first thing I talk to them is, what is your why? And that's a very powerful thing, because if you don't know why you're doing this, you're not going to stick to it when the going gets tough.
Yep.
When I had cancer and the going got really tough, I had to figure out why I wanted to go through all of this, because it was horrible. And so I had a new granddaughter at the time. I had 2 beautiful kids. I had a family. I had a job that I loved. I had a why. And I find that a lot of people don't have a why. They're doing it for other reasons. Maybe somebody told them they have to do it. Their doctor said this. Their spouse is forcing, whatever it may be. You have to do it for yourself, because you need to be successful.
It's very difficult to have a why when there isn't already a problem existing. And that's what we need people to be more open to, is the preventative piece of it. People will reach out when there is a problem.
Right.
So really the why should be, why? Because I want to take good care of myself in general. And certainly it has other implications as well. So it's
well, on that note,
important.
I can tell you, I was healthy before I had cancer. But that one call changed my life, and what I had to go through, I would never have been able to tolerate had I not been healthy before. So that's my message to people, is that you, God forbid, never know when you're going to get that phone call. You need to be prepared. Your body needs to be strong through healthy eating and exercise. So if you ever get that call, and I hope you never do, your body will be able to withstand whatever you need to do.
Well, that is extremely sound advice coming from a diabetes expert and life, and life lessons, expert too. I think that is very clear to me anytime I've ever met you, and certainly now. Your passion is incredible, and thank you so much for sharing with our audience all that you know about diabetes. And I know that they'll be happy to go and look up the different suggestions that you made in your website in order to learn more and potentially get in touch with you. So thank you for joining us, and very happy that you're here.
Thank you so much, Jen.